About the single-payer healthcare system, let's talk a little bit about that. You've touted that as something that New York should become a laboratory for.
Sure.
And in fact, undocumented immigrants would be participating in this particular system. Can you talk a little bit about that?
Sure. What it comes down to is the different models of healthcare that we have today in this country. We have an experiment going on side by side. We have the employer-based, insurance-based model, which is what Obamacare is built upon, giving money to be subsidized so they can go out and buy health insurance. The more people have health insurance, the more you aggregate the risk, everyone's costs come down. And of course, those people that have insurance, they make wiser decisions, they get preventative care, they get checkups. We save money because they don't have the longer illnesses. But there's another model, and that is carving out the insurance company middleman altogether. Mm-hmm. And that's the Medicare and Medicaid model, where we say, look, the insurance companies aren't doing anything except taking our money and passing it along to doctors. Why not pass it along to doctors directly? That difference is about 20% in cost. Mm-hmm. You have about a 1% overhead for Medicare, 20% overhead for most of our insurance plans. And so what I've suggested is, since we have so much control over healthcare in this city, and so many healthcare resources, and a group of about 600,000 people we provide insurance for, HHC hospitals, Department of Health, mm-hmm. Department of Mental Health and Hygiene. So we have the tools to be able to dispense the healthcare, control the costs, and with the savings that we get, we'll not only be able to provide people better wages, but we'll also be able to do things that others have not figured out a way to do, such as provide coverage for the undocumented, which would be excluded from Obamacare. That's about 500,000 to 600,000 people right there. And it's our obligation, I believe, to cover them, if not for their good, then for the good of the taxpayers who will be paying their bills in hospital emergency rooms.